Hi, thanks for choosing to listen to this short explanation I'm going to give on PA behandling or periodontal disease treatment or gum disease treatment as it's more widely known in the UK. So if you just allow me, I'm just going to swap to this screen view just to give you more information on how we plan to go about treatment. So, first of all, let me just talk about the varying degrees of health or unhealthiness that we may find in relation to your gums. First picture here, healthy gums, healthy bone. Gums are pink and healthy. The gums at the level with the enamel. Gingivitis, we have inflammation of the gums, redness, we can have bleeding, but the bone around the gums hasn't changed. Periodontitis, gum disease, the bone shrinks away from the teeth, away from the inflammation, the roots become exposed. If we can show you that in picture forms, this is nice, healthy gums. This is always what we're aiming to achieve when we're doing any kind of treatment in our examinations. This is where we're trying to get your gums to. Gingivitis, inflammation, there's redness around the gums, there's plaque on the gums, there's probably some staining. To some degree or another, we maybe all have a little bit of this in our mouth, but we want to help you keep that to a minimum because the next step on is periodontitis, gum disease. You can see in this case, this is quite an extreme case. The gums have lost their definition. There's a lot of staining on the teeth. There's a build-up of hard deposits of calculus around the teeth. The roots are exposed. There's a gap here. I put any money on it 10, 15 years ago in this patient. There wasn't a gap, but because the bone has shrunk back, there's less support for the tooth, and the teeth can actually move, and we call this drifting or migration. If I put my finger on that and try and move it, I'd expect there'd be some looseness to it. So we need to make a plan so we can treat your disease. We can't make the gum grow back, but we can make the bones become healthy, the gums become healthy, and we can stabilize the disease. But we need to know how to get from A to B and the best, most efficient way to do that. So how do we do that? Well, actually, first thing we're going to do is help teach you or give you more information on how you can make your cleaning even more efficient and effective than it already is. We might show you different tools to use or how to use things in a different way. But we need one of these, a PUD, or for Danes, a PUL. So what is that? Basically, we've got to spend 45 minutes to an hour, depending on how many teeth you've got, measuring 6 points around each tooth, and we're measuring the pockets around the teeth. This is a measure of how much destruction has gone on around the teeth. We also want to measure the plaque. Plaque is an indication of where we need to help you with your cleaning. Bleeding is a sign of active disease, so we want to know all those areas that are bleeding. So we can monitor and measure. Obviously, if there's any discharge from around your gums, we want to be aware of that. And any loosening, there's degrees of loosening. 0 loosening up to 3. 3 means I put my fingers on a tooth and I can physically see it moving over, deflecting over a millimetre. There's a thing called a furcation. That's if you've got more than one root on a tooth, the roots join each other near the crown of the tooth. And that join area is called the furcation. And you can imagine if we uncover that furcation, if the gum uncovers the furcation, that's like a little cave that needs cleaning. So we need to be aware of cleaning that area and where those areas are. So to help us with our plan, we also need x-rays. The x-rays give us a lot of information. They show us the shape of the roots, how long the roots are, how much bone we've got left. You can see the bone on this patient, and it's nearly just disappeared from this tooth. And that gives us a grading of how severe the gum disease is. You imagine if we haven't got the x-rays, it's a little bit like driving our car at night time without any headlights on. It just helps us see further ahead and where we need to concentrate the most and where we need to be aware of is there anything that we can't do for a tooth? So once we've got all that information, we then need to do in UK it's called a full mouth disinfection. But basically, we want to get rid of all those bacteria in your mouth, all the buildup of calculus, all this, as much staining as we can that's below gum level, that's damaging the gums. Just clean that away and give you a clean base to work on. That's going to take us 1 or 2 visits. It depends on how many teeth you've got that's infected by the disease, the difficulty of cleaning your mouth, all sorts of factors as to whether that's going to take 1 or 2 visits. The pricing in Denmark on that, you pay per tooth that's affected by the disease. And that's why when you first come in and see us, and we tell you need some PA behandling, it's quite difficult for us to tell you exactly how much it's going to cost until we've gone round and done the pull. You can actually help yourself, because if your cleaning is improved between us diagnosing the disease and us doing the pull, then the pockets will be less, and that's going to mean less teeth for us to have to charge you to treat. So little top tip there just for you to be aware of. After we've done the cleaning, we're going to go on to the next stage, which means we're going to have to see over 3 to 4 visits over the next 12 months. That's where we're going to be monitoring the disease, looking at the pockets, looking where the bleeding's coming from, doing more cleaning, getting rid of the plaque, bacteria, calculus, to keep the bacterial level as low as possible to help the gums respond as much as possible. After that 12-month period, we then go on and do a new pull, where we measure compared to the previous one. That's going to tell us how well the gums have responded. Are there any other areas we need to concentrate more on? Sometimes if the response hasn't been enough, we have to repeat the process. But again, it's part of our planning and monitoring, and we'll tell you as we go along what we're going to need to do. So, as you can see, there's not a quick fix for treating gum disease or PA behandling. It takes patience. It takes a lot of work from yourself as far as the cleaning, because that's where the secret is. We can get rid of the plaque and bacteria, but you can do it every day. And you might find with all the methods we give you, the extra tools we give you, it might take you 5 or 10 minutes to clean your teeth in the most effective way possible. But the results will show for themselves, and we want to help you along all those steps to give you the best possible result that we can. So thank you for your listening, and look forward to seeing you in the clinic.